My name is Dan MacAlister. I'm the Chief Operating Officer at Paladin Security. I'm privileged to be the co-author of the 6th edition of Hospital and Healthcare Security, co-written with Tony York from HSS, who is one of the great healthcare security minds in our business. We've written this book on the foundation initiated by Russ Colling, who way back in the 1970s wrote the very first edition of Hospital and Healthcare Security and has been involved in all of the editions to date. We're privileged to carry on his tradition for the industry of healthcare security. You know, increasingly healthcare security is becoming a business, and the book is written to bring the practitioner and the reader closer to the actual business of healthcare. That is the business of delivering care to patients. We believe strongly that if we create a safe and secure environment for which staff can deliver care, patients can receive care, we can actually impact positively on the quality of care received by patients. And it's from that foundation that the book is written. There's been a lot of change in the last 5 years in society, and healthcare security is no exception. If we look at technological change, changes in risks, shifts in philosophy organizationally, this book is intended to shift with the times and not only prepare us for the here and now, but to lead us into the future. So it's a very important book for us because we're focusing on a lot of key areas that align the business of healthcare security with the organizations that you serve. We can look at sections around strategic planning as an example, where we're looking to ensure that the healthcare security strategic plan is as closely aligned as possible with the strategic plan of the organization, the mission, vision, and values of the organizations that we serve. As well, there's considerable emphasis put on metrics and key performance indicators as we increasingly move towards an evidence-based decision-making world. We need to be able to justify decisions around resourcing, around security expenditures. And the more we understand the healthcare security metrics and the more we can relate them to the organizational metrics, the more likely we are to be successful in making our business cases to initiate the changes that we believe are necessary given today's risks that are faced by the healthcare industry. As well, if you look at aggression, which is certainly topical, always has been topical in healthcare, are we doing the same things that we always did 5 years ago? I think the answer is no, and the book is reflecting some of the great initiatives that are happening in organizations across the Western world. And again, that's an important distinction. You know, the previous five editions have been written primarily from the vantage point of the American authors. This time around, we're able to not only maintain that, but broaden it, so that for an international audience of healthcare security practitioners in Canada, in the UK, in Europe, and elsewhere in the world, the book is also going to have increased relevance for them and provide an increased focus for them. So we think that's important as well. The other key section that we've written, a brand new chapter on designing safe environments. And increasingly, it's important for healthcare security leaders to be in that design door as early as possible in the process. Whether you're building a new hospital, whether you're renovating an emergency department, or whether you're making any kind of a renovation to your healthcare facility, it's really important that security be built into that design. And based on the work from the IHSS Guidelines Council, which I'm proud to have been a member the last 7 years, working very closely with American colleagues in writing operational guidelines and writing these design guidelines for healthcare, that's allowed us to really focus an entire chapter on that, and we think present a lot of important information for anyone involved in healthcare security leadership, and indeed anyone who aspires to be involved in healthcare security. For me, it's been quite a journey because I've spent more than 20 years in public sector, working in hospitals, providing public service for healthcare security. And the last 3.5 years, been very excited to move to Paladin Security, who are the largest provider of healthcare security services in Canada, providing services from coast to coast, from Newfoundland to here in Vancouver. And what I've done is broaden my perspective, really increase the depth of knowledge that I have in healthcare security. And the reason I've been able to do that is being able to work closely with other organizations across the country and with my colleagues in the United States to look at how they do business, to pull best practices from all of these organizations and really have a broader understanding of the issues that are important to the healthcare security leaders today and that are reflected in this book. Now, who should use this book? You know, from my perspective, there are three key groups. The first is the folks who are brand new to this business. Perhaps you're moving from another occupation, maybe even the criminal justice system, and you move into healthcare as a healthcare manager or a hospital director for healthcare security. And you start to unravel complex and fragile world of healthcare and start to build your program. And what this book does is allow you basically serve as a how-to build a security program. What are the key necessary elements that allow you to build a program that's aligned not only with your philosophy, but with your organization's philosophy? Allows you to identify the key risks and mitigate those risks and deal with emerging trends that folks are talking about today, like terrorism, active shooter, armed intruder, and so on. The book addresses that and allows you to build that into the fabric of your program and move forward into the future with a very strong foundation. The last thing I wanted to say is that the book continues to serve as the key reference for the International Association for Healthcare and Security, Safety and Security's Certified Healthcare Protection Administrator exam, which is really the credential that we all aspire to in healthcare security. The book is one of the key elements of the study materials that you're going to need to write that exam. The exam is exhaustive. It will not be easy, but this book will form a key part of it, and the better understanding, the fuller understanding you have of what the book is addressing, the key subject areas and the key areas that they focus on, the more prepared you're going to be for that exam and the more likely you are to be successful as a CHPA. So for us, we're very excited at the release of this book, the 6th edition, and we hope that folks take advantage of the opportunity to purchase it early and that it serves you well. Thank you.